Theo was 7 years old and had never voluntarily touched an animal. This was documented. His behavioral therapist, Dr. Osei, had worked with Theo for 3 years and had attempted graduated animal exposure 4 times. Each attempt had produced distress, sensory overload, behavioral dysregulation, withdrawal. She had set aside the animal-assisted therapy pathway as not compatible with Theo's profile. The Great Pyrenees at the therapy center's new facility was named Bear. He was 4 years old, certified, trained in therapeutic settings, the kind of animal who moved slowly and was difficult to startle and had a specific quality of patient stillness that the center's director described as a gift. Theo was at the center for a different program. Bear was in the common area. Dr. Osei watched from the hallway as Theo entered the common area, registered Bear, and stopped. He looked at Bear for 45 seconds. Then he walked directly to Bear, sat down against his side, and put his head against the dog's large shoulder. Bear lowered his head slightly and remained still. Theo stayed there for 11 minutes. He did not make any of his usual regulatory sounds. He was quiet in a way that Dr. Osei had not seen from him in 3 years. She stayed in the hallway for those 11 minutes and did not speak. Afterward, she wrote in her notes, Theo initiated voluntary physical contact with a large animal, sustained 11 minutes without distress, spontaneous, unprompted, counter to established profile. She then wrote something she rarely wrote in clinical notes. I don't have a full explanation for this. What exists suggests the breed's low reactivity, their specific body warmth and weight, and their non-demanding quality of presence can create a sensory environment that is regulating rather than overwhelming for some children. For Theo, it was not a therapy protocol. It was just Bear. Theo visits the center weekly now. He goes to Bear first, before anything else. He sits against him for as long as he is allowed. Bear is there every time. Subscribe, bonded, and brave. This is what that looks like.